So let's talk about low libido, why you might have one and what can be done. Libido or desire is our ability to want something. And some women have active desire when they just see the object of their interest and they want to engage in sexual activity. And some women have predominantly responsive desire who might start not being very interested in sexual activity but can be warm up to it. The responsive desire is very normal and it doesn't mean it's an issue. But there are certain factors that influence our ability to desire to be sexually active. Being on oral contraception pills for a long time, breastfeeding, being menopausal, recovering from the surgery, or having some chronic medical condition. There's also emotional component to it. If there is any relationship issues with your partner, some women might develop a defense mechanism due to the trauma experienced in the past. In that case, you will need to work with a therapist first to work through this issue. There are also factors, the way we were brought up, our religious, our cultural beliefs. So we do need to take it all in consideration. Some people might experience secondary low libido. For example, if you have a urinary incontinence or fecal incontinence during sexual activity, you feel uncomfortable and you unlikely want to have sex in the future. So correcting the pelvic floor disorder can actually help your libido. But some women might have what it's called hypoactive sexual desire disorder, meaning your libido is low due to the chemical imbalances in your brain. Some women just can't get turned on, but we still can do something to help with that condition. There are 2 FDA-approved medications to treat that condition. So one medication is flibanserin or ADI. It's a pill that you need to take every day and the effect is cumulative. So you will start noticing changes a few weeks after you start taking the medication. This medication works by stimulating serotonin receptors in your frontal cortex. And some of the pleasant side effects you might notice is that it helps improve your mood, improve your sleep, and can actually help lose a little bit of weight. Couple of things to keep in mind. You do need to take that pill right before you go to bed because in some cases it can cause lower blood pressure. Another medication called bremelanotide or Vyleesi works on melanocortin receptors in your brain. This medication is injectable. You do not need to take it every day, just about 40 to 45 minutes before anticipated sexual activity. Something to remember with this medication, it can cause some nausea when you start using it, so make sure to ask your doctor for some anti-nausea medications like Zofran. And also, it can cause some elevation in your blood pressure, so discuss your medical history with your doctor before starting this medication. Also, it's recommended to use this medication no more than 8 times per month, and the reason behind it that if you use it more often, it can cause some increased pigmentation in the area where you inject the medication. Other medication that can potentially help with libido, hormones. Vaginal estrogen helps perimenopausal, postmenopausal women and women who are on birth control or breastfeeding to maintain the healthy vaginal tissue and produce adequate amount of vaginal lubrication. We start losing testosterone in our mid-30s. So by the time we reach menopause, we have a very low level of testosterone. So we do see more improvement in libido in postmenopausal women who are using testosterone. However, we do see some positive effect in premenopausal women as well, but we just need to do more research before FDA can approve that. And in general, being on hormone replacement therapy helps to maintain your vitality, like maintaining a good vascular health, prevent osteoporosis, and helps with your sexual health. So definitely consider that. There are also some useful tools to help condition your body to respond to sexual activity. For example, vibrators. Vibrators helps to bring more blood flow to your pelvic region. So it helps to maintain a good tissue quality, creates a positive experiences, and make women more likely to want to engage in sexual activity. Same goes to suction devices. They also bring more blood flow and increase pleasure. Using lubricants with sexual activity or masturbation can improve your overall satisfaction and improve your libido moving forward. If you enjoy solo sexual activities and you experience pleasure, you're more likely to want to engage in sexual activities in the future. So it's very important to learn how to experience this pleasure on your own so your body becomes more receptive to it. Having low libido is very common, and there are multiple reasons to have low libido. There are different treatment options, but they are tailored to the causes of the low libido. So that's why it's important to talk to your provider to determine what treatments are best for you.